Welcome to today's video about symptoms of colon cancer. Every year, over 1.9 million people worldwide are diagnosed with colon cancer. But here's the shocking part. Most of them had no idea until it was too late. Did you know that the early signs of colon cancer can be so subtle? You might dismiss them as just a bad diet or stress. Have you ever felt constant bloating, unexplained weight loss? Or maybe you've noticed changes in your bowel habits that just don't seem normal? Here's what doctors aren't telling you. These symptoms could be warning signals from your body. And the earlier you catch them, the higher your chances of survival. But here's the good news. Colon cancer is one of the most preventable and treatable cancers if caught early. And today, I'm going to break down every single symptom you need to watch out for, so you can protect yourself and your loved ones. Stay till the end. It could save a life. Please note, this video is for informational purposes only and is not a replacement for professional medical advice, diagnosis, or treatment. Always consult a healthcare provider for any medical concerns. All research information shared here has been verified by researchers. You can find all references to the studies mentioned in the description below. Now, let's break it down. Here's the first major symptom you need to watch out for. Changes in bowel habits. Noticing persistent changes in your bowel habits can be concerning, as they may signal underlying issues, including colon cancer. Such changes might involve frequent diarrhea or a sudden increase in bowel movements. These alterations can result from a tumor obstructing the colon, causing the body to adjust its waste elimination process. A study published in the European Journal of Cancer in 2009 found a significant association between frequent bowel movements, defined as at least 2 or 3 stools per day, and an increased risk of colorectal cancer. This research highlights the importance of monitoring changes in bowel frequency. It's essential to pay attention to your body's signals. If you experience a noticeable shift in your bowel habits that persists for more than a few weeks, it's advisable to consult a healthcare professional. Early detection plays a crucial role in effectively managing potential health issues. Next, number 2, blood in stool. Noticing blood in your stool can be concerning, and it's important to understand its potential connection to colon cancer. As tumors develop in the colon, they can disrupt the lining, leading to bleeding. This blood may mix with stool, resulting in noticeable red or darker discoloration. In some cases, the bleeding is not visible to the naked eye, but can be detected through tests like the fecal immunochemical test, which identifies hidden blood in the stool. The American Cancer Society highlights that colorectal cancers often bleed into the digestive tract, and while sometimes the blood can be seen in the stool or make it look darker, often the stool looks normal. It's essential to recognize that while blood in the stool can be a symptom of colon cancer, it can also result from other conditions such as hemorrhoids or anal fissures. However, if you observe persistent or unexplained bleeding, it's crucial to consult a healthcare professional promptly for appropriate evaluation and, if necessary, further testing. Next, number 3. Narrow or thin stools. When the colon's interior passage narrows due to a tumor, it can compress the stool, resulting in a pencil-thin shape. This change occurs because the growing mass restricts the normal width of the stool as it moves through the digestive tract. According to Johns Hopkins Medicine, such narrowing can be a symptom of colorectal cancer. However, it's important to note that not all cases of thin stools are indicative of cancer. Occasional narrow stools can result from benign conditions like irritable bowel syndrome or temporary dietary changes. The Mayo Clinic advises that while infrequent narrow stools are usually harmless, persistent pencil-thin stools may warrant medical attention to rule out serious conditions. If you notice a consistent change in your stool's shape, especially accompanied by other symptoms such as blood in the stool, unexplained weight loss, or abdominal discomfort, it's essential to consult a healthcare professional. Early detection plays a crucial role in effectively managing potential health issues. Next, number 4. Unexplained weight loss. Experiencing unexpected weight loss can be concerning, and it's important to understand how it might relate to colon cancer. Cancer cells consume a significant amount of the body's energy, leading to weight loss even if your diet remains unchanged. Additionally, the immune system's response to cancer increases energy expenditure, further contributing to weight loss. Inflammation plays a crucial role as well. The body's release of inflammatory molecules known as cytokines can alter metabolism and suppress appetite, leading to reduced food intake and muscle wasting. This process, often referred to as cachexia, is commonly observed in cancer patients. Tumors in the colon can also cause partial blockages, leading to changes in bowel habits and discomfort after eating. This discomfort may result in eating less, thereby contributing to weight loss. Recent research emphasizes the significance of unintentional weight loss as a potential warning sign. A study published in the British Journal of Cancer in 2020 found that unexpected weight loss was associated with an increased likelihood of gastrointestinal cancers, including colon cancer. If you're experiencing unexplained weight loss, it's essential to consult a healthcare professional promptly. Early detection and intervention can significantly improve outcomes. Next, number 5. Persistent abdominal pain or cramps. Abdominal discomfort can be an important indicator of colon cancer. As tumors develop within the colon, they may obstruct the passage of stool, leading to noticeable pain and cramping. This pain often feels like intermittent cramps in the abdomen. Additionally, the tumor's presence can cause inflammation in the colon's lining. This inflammation not only contributes to discomfort, but also disrupts normal bowel function, potentially leading to changes in bowel habits. A recent study, published in a cancer journal for clinicians in 2023, found that abdominal pain was present in 11.6% of patients diagnosed with early-onset colorectal cancer, compared to 7.7% in individuals without the disease. This highlights the significance of abdominal pain as a potential early warning sign. It's important to note that while abdominal pain is a common symptom, many individuals with colon cancer may not experience any pain, especially in the early stages. Therefore, regular screenings and attention to other symptoms are crucial for early detection. If you experience persistent abdominal discomfort, it's essential to consult a healthcare professional. Early evaluation can lead to prompt diagnosis and more effective treatment. Next, number 6. Feeling of incomplete bowel emptying. A persistent sensation that your bowels aren't fully empty after a movement can be unsettling. This feeling, known medically as tenesmus, might be more than just a minor inconvenience. In some cases, it can be a symptom of colon cancer. When a tumor develops in the rectum or lower colon, it can create a physical obstruction. This blockage may prevent stools from passing smoothly, leading to the sensation that something remains even after a bowel movement. The Royal Marsden Hospital notes that a feeling of incomplete evacuation is quite common if the tumor is in the rectum. Beyond physical blockage, tumors can irritate the rectal lining. This irritation sends false signals to the brain, making you feel the urge to defecate even when there's no stool present. Such miscommunication between the gut and the brain contributes to the persistent sensation of incomplete emptying. It's important to recognize that while tenesmus can result from various conditions, its persistence warrants medical attention. Early detection of colon cancer significantly improves treatment outcomes. Therefore, if you're experiencing this symptom regularly, it's advisable to consult a healthcare professional for a thorough evaluation. Next, number 7. Unexplained fatigue or weakness. Feeling unusually tired or weak can sometimes be more than just a sign of a busy life. It might be your body's way of signaling an underlying issue, such as colon cancer. This type of cancer can cause subtle, yet significant, blood loss within the digestive tract. Over time, even minor bleeding can lead to a decrease in red blood cells, resulting in anemia. Anemia often manifests as persistent fatigue and weakness, as your body isn't getting the oxygen it needs to function optimally. In fact, research published in the World Journal of Surgical Oncology in 2021 indicates that anemia is present in approximately 30 to 75% of colorectal cancer patients. It's important to note that this internal bleeding isn't always visible. You might not notice any changes in your stool. The blood loss can be slow and hidden, making the resulting fatigue one of the earliest noticeable symptoms. Therefore, if you're experiencing unexplained tiredness that doesn't improve with rest, it's essential to consult a healthcare professional. Early detection plays a crucial role in effectively managing colon cancer and improving outcomes. Next, number 8. Dark or tarry stools. Noticing black, tarry stools can be concerning, as it often indicates bleeding within the gastrointestinal tract. This condition, known as melena, typically arises from bleeding in the upper GI regions, such as the stomach or small intestine. However, in certain cases, bleeding from the right side of the colon can also lead to melena. When a tumor develops in the ascending right colon, it can cause bleeding. As blood travels through the intestines, digestive enzymes break it down, turning it dark and giving the stool a black, tarry appearance. This transformation results from the interaction between the blood and digestive substances over time. While melena is more commonly associated with upper GI issues, it's important to recognize that bleeding from the colon, especially the right side, can also present this symptom. A study published in the Mayo Clinic Proceedings, 2024, noted that approximately 10% of melena cases originate from the small bowel or right side of the colon, due to causes such as angiodysplasia and malignancy. It's crucial to understand that not all black stools are indicative of colon cancer. Certain foods, supplements, or medications can also darken stool color. However, if you observe persistent melena, it's essential to consult a healthcare professional promptly. Early evaluation can lead to timely diagnosis and treatment, improving outcomes. Next, number 9. Gas and bloating. When colon cancer develops, it can lead to various digestive issues, including gas and bloating. As tumors grow within the colon, they may partially obstruct the passage of stool and gas. This obstruction causes gas to build up, leading to feelings of fullness and visible abdominal swelling. Additionally, the body's attempt to push contents past the tumor can result in cramping and discomfort. A study published in 2023 in the PLOS One examined gastrointestinal symptoms among older female colorectal cancer survivors. The research found that 54.2% of participants reported persistent bloating and gas, highlighting the prevalence of these symptoms even after treatment. It's important to note that while gas and bloating are common and often related to diet or benign conditions, persistent or unexplained symptoms should not be ignored. If you experience ongoing bloating accompanied by other signs such as changes in bowel habits or unexplained weight loss, it's advisable to consult a healthcare professional for further evaluation. Next, number 11. Loss of appetite. When colon cancer develops, it can lead to a noticeable decrease in appetite. This change often stems from the body's response to the tumor's presence. As the cancer grows, it may cause a partial blockage in the colon, leading to feelings of fullness, nausea, or discomfort after eating, which naturally reduces the desire to eat. Moreover, colon cancer can trigger the release of certain inflammatory molecules, known as cytokines, into the bloodstream. These cytokines can interfere with the brain's hunger signals, diminishing the sensation of hunger. A study published in the Journal of Hematology and Oncology in 2023 highlights that these inflammatory responses are significant contributors to appetite loss in cancer patients. Additionally, the body's metabolic rate may increase as it attempts to combat the cancer, leading to a higher energy expenditure. This heightened metabolism, combined with reduced food intake, can result in weight loss and muscle wasting, further exacerbating the loss of appetite. The American Cancer Society notes that tumors can release hormones that alter the body's normal appetite signals, leading to decreased interest in food. It's important to recognize that a persistent loss of appetite, especially when accompanied by other symptoms like unexplained weight loss or fatigue, should prompt a consultation with a healthcare professional. Early detection and intervention are crucial in managing colon cancer effectively. Next, number 12. Nausea or vomiting. Nausea and vomiting can be significant indicators of colon cancer, often arising from the body's response to various disruptions caused by the disease. One primary cause is a malignant bowel obstruction. As tumors grow within the colon, they can partially or completely block the passage of digested food. This obstruction leads to a backup, causing the stomach and upper intestines to distend, which in turn triggers nausea and the urge to vomit. In advanced cancer cases, studies have shown that delayed gastric emptying occurs in approximately 35 to 44% of patients, contributing to these symptoms. Additionally, the spread of cancer to the liver can induce nausea. When cancer metastasizes to the liver, it can impair liver function, leading to a buildup of toxins in the bloodstream. This accumulation affects the body's metabolic balance, often resulting in persistent nausea. Managing liver-related nausea typically involves the use of anti-sickness medications to control the symptoms. It's important to recognize that while nausea and vomiting are common symptoms associated with colon cancer, they can also result from various other conditions. If you experience persistent nausea or vomiting, it's essential to consult a healthcare professional for a comprehensive evaluation to determine the underlying cause and appropriate management. Next, number 13. Jaundice. When colon cancer spreads, it often targets the liver due to its rich blood supply. This spread, known as metastasis, can disrupt liver function. One significant consequence is jaundice, where the skin and eyes turn yellow. Jaundice occurs because tumors obstruct the bile ducts or extensively infiltrate liver tissue. This blockage prevents bile, a fluid aiding digestion, from flowing properly. As a result, bile accumulates in the bloodstream, leading to the yellowing characteristic of jaundice. A study published in the Journal of Gastrointestinal Oncology in 2024 highlighted the severity of this condition. Researchers found that patients with metastatic colorectal cancer who developed jaundice had a median survival of just 1.5 months. This underscores the aggressive nature of the disease once jaundice manifests. Recognizing jaundice as a potential sign of advanced colon cancer is crucial. Early detection and treatment can improve outcomes and potentially prevent the progression to such severe stages. Next, number 14. Pelvic or lower back pain. Colon cancer can sometimes manifest as pelvic or lower back pain, especially in advanced stages. As tumors grow, they may invade nearby tissues and organs within the pelvic cavity, leading to discomfort or pain in the pelvic region. This pressure can also affect nerves that extend to the lower back, resulting in back pain. Such pain is often persistent and may not improve with typical treatments like physical therapy. Additionally, if the cancer spreads to the spine, it can cause compression of the nerves or spinal cord. leading to back pain. A recent study published in the Journal of Pain Medicine, 2023, found that colon cancer survivors exhibited widespread pressure pain, hypersensitivity, and reduced depths of internal oblique muscles compared to healthy individuals. This suggests that musculoskeletal changes post-treatment may contribute to ongoing pain in these areas. It's important to note that while pelvic or lower back pain can be associated with colon cancer, these symptoms are more commonly linked to other, less serious conditions. However, if you experience persistent pain, accompanied by other symptoms such as changes in bowel habits, unexplained weight loss, or blood in the stool, it's crucial to consult a healthcare professional for a comprehensive evaluation. Next, number 15. Severe constipation. Persistent constipation can sometimes be more than a minor inconvenience. It may signal an underlying issue like colon cancer. When a tumor develops in the colon, it can partially obstruct the passage of stool, leading to severe constipation. This blockage makes bowel movements infrequent and difficult, causing discomfort and straining. A study published in the Clinical Epidemiology in 2019 highlighted that patients with chronic constipation had a higher short-term risk of being diagnosed with gastrointestinal cancers, including colon cancer. The research found that during the first year of follow-up, the standardized incidence ratio for any gastrointestinal cancer was 5.0, indicating a significant association between constipation and cancer diagnoses within that period. It's important to note that while constipation is a common condition with various causes, when it persists and is accompanied by other symptoms such as blood in the stool, unexplained weight loss, or abdominal pain, it warrants prompt medical attention. Early detection of potential underlying causes, like colon cancer, can significantly improve treatment outcomes. Maintaining a diet rich in fiber, staying hydrated, and engaging in regular physical activity are essential steps in promoting healthy bowel movements. However, if you notice persistent changes in your bowel habits, it's crucial to consult a healthcare professional to rule out serious conditions. And that's it for today's video. Now you know the warning signs of colon cancer and why early detection is so important. If even one symptom sounds familiar, don't ignore it. Your health is priceless. If this video was helpful, let us know by typing "helpful" in the comments below. It truly motivates us to bring you more life-saving content like this. And hey, don't forget to hit that like button, subscribe, and turn on the bell icon so you never miss our updates. Stay informed, stay healthy, and I'll see you in the next video.